after the diagnosis, I got the diagnosis from a private hospital. So I eventually went to a general hospital. And there we were consulting with a neurologist. And one key thing that is so particular about all these kids is that early intervention is key.
Early intervention.
We have this fear, just like you rightly said, that what is this? Because for me, like I said, that's my firstborn. I don't have any experience.
Zero.
I've never had anybody around me that had it. So I was just tiptoeing around it. And when we got to the neurologist, general hospital, as everything would be, as you can imagine, they would elongate issues.
Yeah.
So we had series.
Welcome to another episode of Raise a Parent with Raise a Parent Academy. And we're here today to discuss a topic that we as a society don't talk enough about, right? This topic is very, very close to my heart. It's special to me because I've lived the life and I understand what the importance of this conversation is. I've had friends make careless, they're friends, but they didn't mean to. But they made really some careless statements that hurt. And I think it's time that we address it. And if people like myself that have experienced it don't talk about it, then we will. So, you're wondering what the topic is, Abby? Don't worry. It's not that deep. We're going to make it light. And I've brought someone very special to me to discuss this with. My big sister. My biggest of the biggest and the biggest. Yes, the same father and the same mother. Yes, in case you're wondering. Mrs. Oluwatosin Ogunade.
Thank you very much for having me here.
You're welcome.
It's so good to be here.
Yeah, you're feeling like a big sister right now, Abby.
Of course, I'm a big sister. I don't feel like I am.
Yes, I'm the last born. Let's get that one out of the way very fast. Last one of 3. It's not easy. But yeah, they love me like that.
Got my choice.
So, we're going to be talking about parenting neurodivergent kids in the Nigerian homes. Yeah, you guys are wondering, which one is neurodivergent again? And you people have come, this is a parent academy, you people have come again. Yeah. But I brought someone that has lived it, is working through it, and will be able to explain to us what that means. So, Vixis.
Thank you very much. So when we talk about neurodivergent kids, we're talking about kids that are not functioning typically. We have neurotypical children and we have neurodivergent children. So when we talk about neurodivergent kids, they are kids that their brain are not growing, they are not being formed typically like other children, and that makes them unique and different in their own way.
Yes. Keyword, unique and different in their own way. Right. What has been your experience as a mom? So fun thing is, I have a nephew, right? And I love him so much. So much, right? And she's his mom. That's why I've brought her to talk about this. So how has your experience been? I want you to talk about how did you even know, and what is the, for you, in your own case, what exactly is this specific diagnosis that you're working with?
So I had my baby 2011, was actually my firstborn. And a new mom, no mother-in-law, nobody to actually tour the path with you. So it was quite a scare. So I think I was doing my master's then. I was having my master's in Covenant University. So I just took him to the clinic for immunization. And then the nurse just looked at him you need to get into the general hospital. I was like, why? But I didn't understand. Just said me, because it was actually below weight. It was 6 months and it was still weighing like 3 points kg. He was still having the birth weight as at that time. And so when I got the diagnosis, no, I had not gotten the diagnosis. My sister-in-law, that's from my husband's side, took me to a private hospital. Now, this is where medical professionals have to be very careful.
Very.
When I was given that diagnosis, it was as if my child would not amount to anything. So in Nigeria, we have this mindset that children with, I'll be using two terms actually, neurodivergent and intellectual disabilities. So when we say we have this derogatory way of looking at them, of thinking they can now amount to anything. But the beautiful thing is that they are just as typical as any other child can be, in as much as you are able to walk the path with them and get support.
Support.
Yeah. Thank you very much.
So I know this is, for us, is a very heavy topic. So in case you see some tears, please bear with us. It's because we know where we are coming from. And I remember where I was when you called me. When you called me, and what I heard at the other side of the phone was my sister broken. And at that time, what came to my mind was, I don't know what this thing is. I have zero information about it. But whatever it is, we're in this together, right? So I want you to talk around some of the things, the next steps you took.
Okay.
Because, there's always this fear that comes with it. It comes with, and I think I want to also, when we say neurodivergent kids, I'm going to use some diagnoses. I'm going to mention some diagnoses. And this is the medical terms, we have Down syndrome. We have autism.
We have cerebral palsy.
They all fall under
intellectual disabilities. We call them intellectual disabilities or neurodivergent kids.
Neurodivergent kids. So I'm being careful about the word because I know how sensitive this topic can be, right? And that's why I'm doing this with my sister, because I don't want to mishandle the conversation. So I want you to talk about what are the actionable steps you took, because there might be a parent out there that just got that diagnosis.
Yeah.
I know how getting that diagnosis.
After the diagnosis. Yeah. So after the diagnosis, I got the diagnosis from a private hospital. So I eventually went to a general hospital. And there we were consulting with a neurologist. And one key thing that is so particular about all these kids is that early intervention is key.
Early intervention.
We have this fear, just like you rightly said, that what is this? Because for me, like I said, that's my firstborn. I don't have any experience.
Zero.
I've never had anybody around me that had it. So I was just tiptoeing around it. And when we got to the neurologist, general hospitals, everything would be as you can imagine. They would elongate issues.
Yeah.
So we had a series of tests to do. We had to do echo. We had to do ECG.
Bear in mind, he was a baby.
He was a baby. It was no, it wasn't a baby. It was a year.
Okay.
Because I got the diagnosis when it was 6-7 months. I was still processing. I didn't start action immediately.
Yeah.
Let me put that out there. I was processing because the first question I was asking myself is, why me?
Why me? Yeah.
Because I was wondering, after everything, but we thank God today. So, neurologists, we went to the neurologist and we did series of tests, echo, ECG, and then later we were referred to another hospital. Now, this is where I call this hospital a one-stop shop for children with intellectual diversity, because when it comes to them, they need a lot of attention. They need physical, they need occupational therapy, physical therapy, because they won't work. For my son's neck control didn't come up until it was a year. At 3 months, a typical child has neck control.
Yeah.
My baby's neck control did not come up till like a year. We had to do a lot of therapies before he could have that neck control. Then sitting, standing, it didn't work until it was 2. So that is where the early intervention comes in, because if you're not careful, you just want to leave the child and then say that, well, you just leave most parents actually lock their children up.
Yeah.
I don't want them to be seen. And that's sad.
Yeah. So this will take me to my next question. Family was very key for us.
Yes.
Yeah. Because we also had to educate ourselves on what are we dealing with. Because if you have a family member and, this is what has happened to them, I'm going to talk from a section of a family member. That's not the time to say it's not your problem. That's not the time to say, he's not my child. That's the time to show up, because your support might be the only thing. So what she didn't tell you is that few months that she didn't know what to do, we all started researching. We all started asking questions. We all sat down, my dad, my brother, my in-laws. We sat down and said, okay, so what are the next things? And had to practically push her away to say, no, these are the things we need to do. And that brings me to the other side of, this conversation where I want to say, I remember there was a time I was working with my nephew. He wanted to pee. We went for a church event and I was working with him. I don't think I've told you this. I don't tell you things like that. I was working with him and I was outside and a woman just walked up to me and said, why are you bringing this boy outside? Why is he outside? You leave him at home. And I looked at the woman and I said, why should I leave him at home? Is it different from you? What makes you special? That was the kind of thing I had to tell the woman. And she goes like, she felt so bad. She was like, I have a child like that. And I said, so where is your child? I don't used to carry him around though. And that broke me. That's a mother of a child. And I realized at that moment that it's not because she doesn't want to love that child. It's because she felt shame.
Yeah.
And why is she feeling shame? Is what the society, the reality of the society that we find ourselves in. So my question to you would be, how have you navigated stereotype?
Well, for me, I think the foundational thing was that I didn't have issues with my family, whether from my husband's side, my in-laws, or my nuclear family. It was loved. So with that, we could weather any storm. So I don't care what people say. They might say it behind me, actually. Nobody has ever come to meet me, actually, that why are you bringing your son? My child goes out with me everywhere I go. If his siblings are going out, we go together.
We all go together.
If there's a family function, we go together. If you like, stare at him from now till tomorrow. I care no less. So I've developed a tough skin, actually.
Yeah.
When it comes to, because at the Nigerian setting, you will see the stare. You will see the stare.
We have no shades.
They will stare. They will actually stare. They will stare for him walking down. And when they do like stare, I still did it yesterday when we went for the church function. We were walking along the aisle, and I just saw that person. I just picked my son, gave him a hug, and we're going. I actually don't care, because Nigerians have this way of thinking that they are below them. They think that these children can't amount to anything. But you'll be shocked.
Very shocked.
At what they can do if you just let them do it. They might take time. Like, that's what I tell people. They might take time, but eventually they will get there.
Yeah.
So why... You're just depriving that child of maximizing his own potential when you are hiding the child. And it's not some people's fault, actually. They actually don't know what
to do. And that's why we are doing this. We are sharing so that, other families that find themselves in this situation know how to do better, right? How to navigate this terrain. It can be scary. I'm not going to lie. It can be very scary, but seeing how far my nephew has been now, when I see him now, he's my G, by the way. When I see him now, and there was a time we were contemplating if he was going to be able to talk, or maybe we should teach him sign language or not. But I see him able to communicate, and I know how far we've come, right? The key thing for me is, information is key. Right? Yeah. Navigating that terrain. And if you see a parent with a neurodivergent kid, it's not your time to stare. It's not your time to feel like... I've had a situation whereby a friend goes like as if they're going to stain them. I'm like,
it's not contagious.
It's human, It's a human being. They are human beings. They are part of our society. And I'm still going to come back to where, government, what's government role in all this? They are a part of the society. They have every right. The same way you have every right to this society is the same way they have every right in this society. If you don't understand it, that's fine. We're educating you. So if I find out that you're a Raise Parents Academy community member, I will come and ask you that we've advised you enough. Why are you still acting like this? I'm going to go to, people think that people struggle. And sometimes I don't blame them. Even you'll be surprised that people that are educated, properly educated, PhD standard kind of education, still have that, reservation. So how have you helped him to navigate life?
Okay, so my child's diagnosis is Down syndrome. So for them, they don't speak on time. They have slurred speech. And then they could be nonverbal if you're not careful. So first things I did, the early intervention, we did speech therapy.
Yeah.
And then we did physical therapy because of his development milestones.
Yes.
Okay. And then we did what we call soft skills. Because the way their thumbs are, their fingers are very short. It's not easy for them to button a shirt. It's not easy for them to tie a shoelace. So you have to be intentional about those things. So you just have to teach them. So we had to get a teddy bear that would help him to learn how to button up a shirt. Even his shoelaces till now, we are still on that stage. My son hates shoelaces with anything. Get him a shoe with shoelaces.
You're looking for trouble.
He will just dump it somewhere. He hates stress. It's like you're stressing him. So we have those soft skills. And then the potty training.
That one.
That's another
memories.
That's another issue, because he was using diapers till he was 3. I just had to say, we can't continue like this. So he was potty trained. I had help. I had help.
Takes a village.
I had help. I had support. My husband was a huge support.
Mm-hmm.
His family, my family. I had him. So I could take him anywhere.
Mm-hmm.
So they could go for holiday at my sister's,
Mm-hmm.
holiday at my brother's, anywhere. Around the family circle now. And I won't be fidgety because I knew it was loved. So we had to do that. Then when I enrolled him in school, I enrolled him in a typical school at first.
Yeah.
So it was going to then, at the typical school, I had to tell them. So he had teachers that were patient. He can read excellently.
Actually.
He can read excellently. He knows his numbers, his arithmetic, simple arithmetic is top notch. So he was doing that bit by bit. And then when it got to basic 4, I got to see that he couldn't learn at that pace again. You know, when they are in the early childhood class, the KG, nursery, lower basic, the teachers there can actually still come down and manage, take them bit by bit. But when they are going to upper basic, my son will be 15 next year, January. So when they're going to upper basic classes, the trend is faster. So I had to pull him, take him to a special school. An inclusive, we call them inclusive schools, where you have typical children and neurodivergent children learning together. So I took him to that school, and then we were able to help. He will be going to GS3 next session. And so far, so good. So I wanted to say, when he was in that lower basic, the PKG school, his school was actually not far from my house. So I had to make sure that, not that I couldn't go and pick him or anything, but I make sure we walk. And there was a reason for that.
Exercise is key.
Because of his legs, so that he could have a fine tone on his legs. He could work without wobbling. So we walked all through those when he was 4, 5, 6. He was walking.
Very
well. He would walk, take those steps so that his walking would not be wobbling. Like that. So those are the things, the little things. Then we did physical therapy for the neck, for the speech. The speech is key. The speech is actually continuous. We are still on speech therapy.
All right. Thank you for being so vulnerable. I know this is something that you're doing for me. And also, we feel like it's time to, the information we've gathered over the years, we feel like it's time to share.
Yes.
Because we realize that the wins that we have is not every household.
No, it's not every household.
It's not every household.
Sorry to cut you short. So sometimes when I take him to check for checkups, I will hear statements like, "Why is he here? He's okay.
There's nothing
wrong with him." Because he's actually thriving. Let me put it that way.
By the grace of God.
By God's grace, he's thriving. And I even get slack on his checkups sometimes because I know that they just not the same thing. But those checkups are actually very necessary to be able to map out the next stage
for them. So I'm going to I'm going to go to this aspect, and because I feel like it's important. If we listen to everything she said family. She has mentioned family, over and over and over again, right? Family, caregivers, they're actually really nice caregivers. But you have to be intentional about finding them and taking your time. It's not something you rush into. You have to be intentional and take your time to, do that. So how has this affected your life as a mom? As an individual, not just as a mom. Your life, your husband's, how has it affected you guys?
So when I had him, I was on mat leave, and then I was doing my master's. I couldn't go back to work for like 2-3 years.
Yeah.
2 years I was off work because we have to go for sessions.
Yeah.
And I can't toy with those sessions. And I couldn't trust him with any other person as at then. So I now, later on, because I was actually into customer care and HR activities, yes. But I had to drop all those things so that I could focus on him. Now, I'm not regretting that action.
Speak. Yes.
I am not regretting that action at all. So, 2 years down the line, then I had employment with the Lagos state government. So I'm a civil servant. So which gives me more time to actually navigate. And wherever I work, I let them know that I have a child with special needs and I need to take care of this child. And so far, so good. I've had bosses.
Yeah, supportive bosses. Yeah. What of your husband?
My husband is a great help. We share sessions.
Yeah.
So if I can't go, he would go. Or we go together. So we share sessions. So it's been the truth of the matter is, without support, it will be draining.
Very.
And tasking. So whether it's friends supporting or family supporting, for me, it was my family. Both my husband's family and my family, they were huge. They would hear something and then they would say, okay, we heard this. Can we do this? Can we do this?
Everybody was on research.
So everybody was on...
Yeah.
Even till now, if you see anything that we think could be of help to him, we do that immediately so that it can be a full... It is... For instance, his memory is... He tells us... God. He's the one that tells us dates.
His memory is... Oh my God. He has... God, I don't even know how to say. He can... If you can't promise him something and you don't do it, that's one. Number two, you cannot tell him how these things are. This is how you should do something, and then you divert from it. He will remind you that, no, this is not the sequence at which you said it. His memory is so sharp. Like, sometimes I'm in awe.
And then sometimes it is true what he writes, because he likes writing, that I know what he has studied in school that day. He will write everything down for you offhand. If he did physical education, he will write, maybe they did topic on skin. I will just be saying, what is skin? Skin is this. I wonder. I'm still asking myself how I'm going to harness that. All those, because his memory is actually top notch. Yeah. When it comes to memorizing.
Do you think government, the Nigerian government, do you think that, and I know maybe this is something I might be trolled for, I really don't care. Do you think government have put initiatives in place to support neurodivergent children in Nigeria?
Well, I would say they are trying.
I agree. They are trying.
They're actually trying. The Lagos State government, for instance, have LASODA. That's the section, Lagos State, I can't, for children with disabilities, maybe physical, intellectual. We have LASODA for that. And we have non-governmental organizations too that are coming up. But the governments are actually trying. They are trying to, for instance, they want to make sure that no child is left behind. Yeah. And we have some government schools that are actually special schools. So, but then when I come to their limitations now is that they focus more. And because we say early intervention, actually, they focus more on the
Little ones.
the nitty-gritty, the speaking, the writing, the social interaction.
Yeah.
So it now comes to when this child is grown, what next? And that is where we are now in Nigeria. We've not been able to move it ahead of when they are kids.
To what is the adult world like?
To their adult world. How would this child be independent? What would this child be doing? How would this child fend for himself or herself? Because the parents won't always be there. The caregivers won't always be there.
True.
As they are growing, I was listening to someone that says that they have like a 50-year-old that is still not potty trained. How did we get there? So the government, they are trying actually to be candid, to make sure that we have an inclusive environment. But they can do better. They can do more.
We can take it more.
They can take it.
A notch,
Yes. We have, for now, we have technical schools. And then I just think that we should have vocational schools void of technical schools, because we don't have vocational schools again. Though we have the local governments, they are trying to we have vocational schools in some local governments. But we want, I think, vocational schools that can cater for children with special needs, especially children with that are neurodivergent, that they have intellectual diversity. We need those, because we just need them to. And this is where the parents is somehow drained, because you don't even know where to go. If you are not intentional,
you won't know what
you
to
won't
do.
get, you don't know what to do. So for this summer, I was looking at what would my child do? I heard that he was doing shoemaking in school. Okay. I had to go in search for a shoemaker. Okay. Now, and I can't just take him to any shoemaker. I needed someone that is patient, someone that understands him. And he started his shoemaking class last week. So
You get to do free shoes.
So as a parent, you just have to be intentional. You can't wait for government.
You can't wait for government.
Because governments can't do everything.
Yeah.
So we can't wait for them.
You can't wait for government.
They are trying. So whilst you make use of the facilities that you have, for instance, the one-stop shop I was talking about was actually a government.
Yeah, government facility.
Is the children's section of the, what do we call the psychiatric hospital? You know, we have the adult section. I never knew we had the children's section.
Honestly, until you go to some of these facilities, you won't know
And they're actually,
how
it's
much
actually
government has
well-equipped.
invested in those places.
It's actually well equipped. You have occupational therapists there. You have physical therapists there. You have educational therapists there. You have speech therapy. That's why I call it a one-stop shop for anybody that is neurodivergent. It's a one-stop shop. And it's government-owned, because if it is private, you'll be paying through your nose. It's not actually. And with the economy now, you'll say, well, let's eat first. So you just have to look for all this. You have to be, as a mother with neurodivergent kids, or as a parent with a neurodivergent kid, you have to be on your toes all the time to look out for opportunities that your kids can have at every particular time.
So does this stop you from, there are some people that I've had situations where someone will say, it's draining me. It's taking so much from me. I just want to break. I just want to rest. I need a break. And I rarely hear that from you. I think I'm even the one that will say, I want to rest. And you'll be like, oh, bring the kids over. Does it, sometimes how do you navigate all that,
It's going to be draining. You won't be human if you say it is not draining. Yeah. It is. It is. But you just look at the child and you pick yourself up again. Then as they grow, it gets easier, actually.
It does, because right now we're lounging.
as they grow. When he was a baby, when he had to sit, when he had to potty train, when he had to, yes. But now, my son can be in the room. There was a day somebody came and said, is it at home? He's at home. Oh. My normal boy before, no. But today, he's very calm now. Because it was hyper too. So there's this what we call ADHD.
ADHD.
So it was very hyper too as at then.
Yeah.
And then so just have to balance it. So yes, it can be draining. I would lie if I say it's not. It can be, because for me, it was my firstborn. And it was like, what is this? Even to get pregnant for another child was scary. Very, very scary, because I was like, I can't have two of this. So it was very, very scary. But then,
so there's this school of thoughts, and I find it amongst Nigerians, and I'm not trying to throw Nigerians really. We are trying to look within our society, right, to make it better. There's this ideology that, there are some people that will say, I've heard someone carelessly say, it's only God that knows what their parents were thinking before the child became this way. And that day, I had to take my time to school the person. It's a medical condition. The father or the mother did not have anything. It's not because they had a viral infection. Or maybe they contracted a disease. No. Do you want to talk about that?
Yes. Let me just quickly dive into that. So, like I said, it's my first. And I was a virgin till I got married. So I'm a Christian. Let me not say I'm a religious person. I'm a Christian. So I try as much as possible to work according to my Christian principles. So we didn't do anything wrong. Now for Down syndrome, actually, it's an extra copy of a chromosome. So it is at that early stage when the cells are dividing, and the meiosis, the mitosis, that biology, chromosomes.
Yeah.
So when you have an extra copy of the chromosome, it's supposed to be 21, and they have an extra copy.
Yeah.
So that's why they call it trisomy 23. That's the medical term for Down syndrome, trisomy 23. So trisomy 21, that is having three triplets of that chromosome. So when you have, we didn't do anything wrong. The Down syndrome is not a condition where you would know.
Yeah.
Then we don't even have that testing in Nigeria. Abroad, you would get, at some stage in your pregnancy, they could tell you that, okay, this child is going to be challenged. This child will be. But we don't even have, we don't have that testing.
Did you even know?
Did I even know that?
We didn't even know. We didn't have any information.
You understand? So I didn't have any information.
I think that was why when I got pregnant,
I was on
you were on my case, like, you need to.
I just, if you told me, I just said, well, first thing first, make sure you don't play with your vitamins. And that's one thing pregnant women should, be careful about. You see that folic acid, as small as it is.
It's very powerful.
It's very powerful. Don't joke with your folic acid as a woman.
Yeah. So your vitamins and everything.
Your vitamins is key.
Yeah. So I'm so thankful. We didn't cry.
We didn't cry. I told you we are not crying.
We are not good at this. I want us to put this into perspective to say that the reason why we've done this episode is that we want you to be kind.
Yes.
When you see a parent with a neurodivergent child, be kind.
That parent is going through
a lot. And when you see them even going the extra mile and being intentional, it's not your time to judge and say, why are you wasting your time? They're not wasting their time.
Some people will say you're even wasting your money.
Yeah, they will even say you're wasting your money. You're not wasting your time. You're not wasting your money. You're giving that child the best chance in living the most independent life that they can live. I can sit with my nephew for hours and gist. We can laugh. He can pick on me and I'll pick on him back. He doesn't really like cameras that much. But he takes pictures for my sake. So I'm okay with that because he knows I like it. You can build those bonds and relationship. I always tell people that the most important thing is love.
Yeah.
When you love them, they flourish.
And they know
if you love them.
And they know if you're faking it.
Like one day we were going out. I you know this gist that I have, I don't usually tell you. It's usually between me and him. There was a day we were hanging out, we were just trolling and somebody was looking at him. And I was wondering how he was feeling. Do you know what he did? He looked at the person back. Like, okay. We always be looking at each other. I laughed. I was laughing. Like, why did you do that? And then I asked her, he said, she was looking at me. So I looked at her. I looked at him, I'm like, nice. So you have to, be careful. You think that they don't see you. They see you. You feel like you think that they can't tell how you make them feel. They know how you make them feel. So let's support a parent today. Be a helping hand. Don't judge. Don't say I'm not going to use any of those words on this show because you can't even say them near me. Don't use condescending words around them. They are valued, they are loved, and they're members of our society, and they deserve to live the same way you are living. Okay? And shout out to our government for, the things they've done. We want more. We're not greedy.
Oliver Twist.
Yeah, we want more. Thank you. There you go. So what will you be the last thing you would tell, parents like yourself? What will you like to tell them?
Okay, parents like myself. First, if you're just getting your diagnosis, don't despair.
Don't despair.
You will be shocked. Mm-hmm. Just make sure the child gets early intervention.
Yeah.
Just make sure, as you're getting your diagnosis, straight up to the neurologist. Don't waste time.
Don't waste time.
Because every time counts. Especially when they are young.
Yeah.
Between 0 to 3, they should have a foundation.
Yeah.
So they need to know how to speak correctly. That's how when you see a neurodivergent child speaking, he has worked. The children are really working because that speech therapy is not easy.
It's not easy.
It's painful, actually. Very painful. So don't despair. Don't despair. Early intervention is key.
Mm-hmm.
That's the best thing you can give that child as at that time. And please don't hide your child.
Don't hide your child, please. Like, if you don't take anything from here, take this. Don't hide your child. Be kind and love them. I mean, if you have a family member, this is your cue to love them. Like, that's the only thing that will make them survive. Just think, maybe if I don't love this child might not survive. Just say that to yourself and, show them love. All right? So that's it from us.
Yes.
The sisters. Yeah. I hope you learned something. Thank you. And see you in season 2. Bye.
Bye.
Subscribe to my mommy's YouTube channel. Raise a parent now.